So some of the clients that may benefit from the Minister lift chair are clients that have poor motor control, clients with muscular sclerosis, clients that had a stroke, clients with neurological conditions, dementia, and so forth. So one thing that is particularly important to mention is because we can customize parts of the lift chair, like the lateral supports, the head support, the lumbar area, we can recline fully, we can tilt the chair. This will allow the clinician to really fine-tune in relation to the posture that the client presents. I will show you how the individual pockets work. So they are overfilled, as you can see, and then depending on the presentation of the individual, we just remove filling out of the pockets just to really get that almost bespoke position that will support not just posture management, but also pressure distribution, function, and comfort. So as I mentioned, with this population group or the clients that would benefit from a Minister lift chair really come with some most common partial asymmetries or compensations. We can mention reduced trunk control that will lead to posterior pelvic tilt, that can also trigger thoracic kyphosis, pelvic obliquity and pelvic rotation. We have quite a lot of lateral leaning as a compensation of sitting for long periods of time, and muscle fatigue happens. The center of gravity moves backwards and the body just slides forward as a natural compensation of prolonged sitting. Some of those clients would also have joint contractures, and that's something that we have to account for when we talk about people with poor motor control and less physical activity, not to mention the head and neck misalignment that will be quite beneficial to have adjustment independent to accommodate those clients. When we factor the comorbidities like osteoporosis, arthritis, and diabetes, we also have to account for pain, fatigue, and joint stiffness, and also poor circulation. So when we have clients with a combination of different clinical presentations, it's important to have those individual areas that we can adjust, including the elevating leg rest. So when we trigger the elevating leg rest, that will increase also that venous return, and the edema of lower legs will be accommodated. However, I think it's important to mention that when we do that, we are impacting on hip and knee extension. So it's a very good function that we can use in combination with the reclining. However, and I'm going to use the hemi just to quickly demonstrate, if a client has already shortening hamstrings, if they don't stand, if they don't walk for long periods of times during the day, what happens is we are going to have those tight hamstrings. If we increase the angle and if we extend the knee and flex the hip, what will happen is the pelvis may slide forward. So you can individually use just minor elevating leg rest if you have a client with those joint contractures around the hips and the knees, and then fine-tune with the back reclining and the activation of the tilt to use gravity in our client's advantage. When we do that, we also increase good pressure distribution, we increase comfort, and we'll reduce fatigue throughout the day.